Okay, I believe all the permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Well, the holiday season's in full swing, and many of us have been gathering with family, friends, and coworkers, or have plans to do so over the next few weeks. As we've discussed before, the season has coincided with a significant increase in respiratory viruses that are circulating both in Ohio and across the country, particularly RSV and influenza. And of course, COVID-19 continues to drive illnesses and hospitalizations as well. Now, these viruses all have the ability to cause serious illness. And of course, large gatherings in indoor settings only increase that risk. The good news is that even amid this triple threat of 3 serious respiratory viruses circulating at one time, we're in a better spot than we have been in the past 2 years. We have more tools at our disposal, particularly when it comes to COVID-19. We also have the very important tools of prevention, which I'll talk about in a little bit more. First, though, I'll start with an overview of what's going on currently with the 3 viruses of most concern. RSV, which primarily affects young children, as well as some of our more vulnerable adults, had a very early and rapid rise this fall. Thankfully, over the past few weeks, we've seen RSV begin to decline, both here in Ohio and nationally. In fact, the CDC reports that RSV hospitalizations have fallen by 2/3 over the past month. The rate remains high, but it's not near the peak we experienced in mid-November. Nevertheless, RSV is not gone, and we need to be mindful that it continues to pose a risk. We also saw one of the earliest rises in influenza cases this fall. Indeed, flu started early and increased very rapidly to one of the highest peaks that we've seen in recent years. As with RSV, though, we're relieved that last week, both the CDC and our own statewide surveillance revealed a drop in influenza-related hospitalizations. Now, while that slight drop is welcome, based on past experience, it seems unlikely that influenza cases will now drop quickly toward a low number. More likely, we're looking at a situation where we could see sustained high levels with peaks and valleys for a number of weeks. That kind of sustained high plateau, perhaps with small peaks and valleys, is pretty typical of influenza. Meanwhile, COVID-19 cases have increased moderately in Ohio in recent weeks. But despite the dominance of the BQ.1 subvariant of Omicron, as well as its descendants, which appear to have a significant ability to evade antibody-based immunity, these variants don't seem to be having much success in evading the more durable B and T cell immunity stimulated by our COVID-19 vaccines. B and T cell immunity, as you'll recall, is the key to protecting most of us from the kind of serious illness that leads to COVID hospitalizations. That speaks again to the importance and the power of vaccinations. Indeed, we're just not seeing the kinds of peaks in cases or hospitalizations that we've seen with the arrival of other new dominant variants in the past. Looking at COVID-19 hospitalizations by this time in mid-December of 2020 and 2021, Ohio was experiencing anywhere from 2,000 to 3,000 people hospitalized every week. This year, the numbers are about 600 a week. So that's at least a 70% improvement from the past 2 Decembers. So there certainly is some good news here. But I also want to caution that we need to be mindful of the collective impact of all three of these viruses, which have a proven ability to cause severe illness. Unlike the last two winters, it's not just about COVID, but the combination of COVID, influenza, and RSV, especially for those whose health is more vulnerable or who have not been adequately vaccinated against flu and COVID-19. Now, I've mentioned before that unfortunately, there is no RSV vaccine currently available, although a vaccine does appear to be on the near horizon, which perhaps will help us in subsequent RSV seasons. With RSV then, prevention is key. And some of these prevention techniques for RSV, of course, work for the other two viruses as well. One of the most important prevention tools we have is to stay home and away from others when we're not feeling well. When you're under the weather, stay away from other people as much as possible. Wearing a mask in public may also be appropriate, especially if you may be in a crowded indoor space. An N95 mask is the most helpful, especially if you're in a particularly vulnerable group, such as those 65 and older, or those who are immunocompromised or have serious chronic health conditions. And then there is one of the simplest and perhaps most important components of prevention, and that's hand hygiene. Remember, in many cases, it's possible to transfer the virus if you sneeze or cough into your hands and then touch other surfaces, and then other people contact those surfaces. Regular hand washing or hand sanitizing remain very important prevention techniques against many viruses. And when it comes to influenza and COVID-19, we also have the benefit of vaccines. And it does appear that this year's flu vaccine is accurately targeting the most common types of flu that we're seeing lead to severe illness, the H3 and H1N1 strains. Now, I would encourage everyone who has not received a flu vaccine to get one. It's not too late to help you stay healthy as the flu season continues well into the new year. I'd also strongly encourage you to get your children vaccinated for the flu as well. Now, you've heard me say many times that the COVID-19 vaccines that we have are highly effective, and that if you are not vaccinated or appropriately boosted, I strongly encourage you to do that too. Vaccination is the safest and most dependable way to assure that you're maximizing that cellular immunity I talked about. It gives your immune system its best opportunity to confront and beat the virus. Now, early treatment for flu and COVID is another important consideration. With COVID, we have an effective treatment for many people called Paxlovid, but it requires beginning the medication very shortly after starting to experience symptoms. I recommend making sure you have COVID tests on hand and then contacting your provider right away if you're older, unvaccinated, or have certain medical conditions, including chronic heart or lung disease or a weakened immune system, and have a positive COVID test. Incidentally, the federal government recently resumed its program of delivering free COVID tests to your door. So if you've not done so, you can go to covid.gov/tests and order those. Even if your COVID test, though, comes back negative, if you're experiencing flu-like symptoms, it's a good idea to contact your healthcare provider to see if treatment with Tamiflu, which is the flu treatment, is appropriate. And of course, if you're feeling seriously ill, seek prompt medical attention. Now, I'd like to turn to our guest today. We're very pleased to be joined by Dr. Joe Gastaldo, the Medical Director of Infectious Diseases at Ohio Health, to further discuss prevention techniques and treatments for these important respiratory viruses. Good morning, Dr. Gastaldo. Dr. Gastaldo, I think you might be muted.
Oh, thank you. Good morning, Dr. Vanderhoff, and happy holidays to everybody. Thanks for having me.
Wonderful. Glad to have you. Can you provide us with a little more detail about ways that people can protect themselves from either getting these viruses or from exposing others to them? And as a part of that, perhaps you could discuss when and where it makes sense to wear a mask, and maybe a little bit also about ventilation as people are gathering indoors.
Yeah, so hopefully this is a conversation that we've been having now for a couple of years. So everybody has kind of heard this before, but again, it's very good to repeat it. I think most importantly, if you're not feeling well or somebody in your family or your close circle is not feeling well, stay home, isolate yourself. If you're not feeling well, if you have a respiratory virus, we don't want you going to work. You have to be very cognizant of you spreading viruses to other individuals. I know in the real world, people sometimes do have to leave the house if they're not feeling well with a respiratory virus symptom. In that situation, I would strongly recommend people wear a high quality mask if you have to leave the house. I think it's very important too to understand that we have tools that are available. We're all familiar with the COVID-19 tools that we have. It's very important for people to be up to date on their vaccines, meaning that if they're eligible to receive the new bivalent booster, that they receive it. And also too, to get a flu shot. Flu makes a lot of people sick. Even if you're not hospitalized for flu and you have flu at home, you're going to be quite miserable for a few days. The flu shot is FDA approved for everybody 6 months and older. And like the COVID-19 vaccine, if you get the flu shot, you have a good layer of protection against severe disease, subsequently resulting in hospitalization and death. Also, too, have a plan in place. I've been saying that for a long time now. Have a plan in place. If you're not feeling well, what is your plan to get tested for COVID-19? People should have home tests. They're available, like Dr. Vanderhoff mentioned. The federal government has made them available. If you have an at-risk condition and you have COVID, what's your plan to get outpatient treatments, antiviral pills? And then what is your plan to get a flu test so you can get outpatient treatment for influenza? I think moving forward, there are many situations where people should decide really to wear a high quality mask. Specifically, pay attention to what's going around in your area. The CDC still produces a county by county COVID community level. And if you live in a county or you hear of an advisory to wear a mask indoors in public, regardless of your vaccination status, you should be following that recommendation if it comes to that. There are some counties in the state of Ohio who do have high community level of COVID. And in those scenarios, regardless of vaccination status, the recommendation is to wear a mask. If you're not feeling well, wear a mask. I think specifically if you have an at-risk condition or immunocompromised, I would advise you as an infectious disease doctor to wear a mask indoors in public. We have the tools available, and it's just a matter of people understanding how to access them. Paying attention to the ventilation of air is very important. Viruses can stay suspended in the air for a while. And if you have good airflow, that helps dilute the air and get the viruses out of the air that you're actually breathing. Easy ways to really improve the ventilation is to crack the window, crack the door. I know coming up here on Christmas Eve at my parents' house, we're going to crack the windows, crack the door. Just be cognizant of amount of people you have in the room. I think it makes complete sense too, if somebody there is vulnerable, like an immunocompromised person or a transplant person, consider wearing a mask or doing a rapid COVID test before you get together.
Dr. Castaldo, could you say a little bit more about the available outpatient treatments, Paxlovid for COVID and Tamiflu for flu?
Yeah, let's talk about Paxlovid first. So Paxlovid is a medication that's been around now for over a year. It is something that you give to anybody with an at-risk condition who has confirmed COVID, regardless of their vaccination status. And I think a common question I get is, what is an at-risk condition? And intentionally, it's a very broad umbrella of being overweight, physical inactivity, heart disease, lung disease, diabetes, immunocompromised state, anybody with a mental health care condition. Intentionally, it is very broad. So first of all, figure out if you have an at-risk condition. And then if you do have an at-risk condition, what's your plan? What's your plan to to get tested at home, what's your plan to get connected to a provider. Paxlovid does have a significant risk reduction in keeping people out of the hospital, preventing death. One thing for Paxlovid you have to be cognizant of is Paxlovid does have many drug-drug interactions with commonly used medications people take. Many of the drug interactions are quite manageable, meaning that you just hold the drug and then just restart it after the Paxlovid course ends. So have that conversation now with your doctor ahead of time. So if you do have an at-risk condition, you need Paxlovid, you have a plan in place. The other tool in the box that we have specifically for flu is a medication I think most people have heard before. It goes by the trade name of Tamiflu or oseltamivir. Tamiflu's window to take, unlike Paxlovid, which is 5 days, its best benefit in making people feel better is taking it within 2 days of symptom onset. So again, it's imperative that you have a plan in place to get tested for flu. And for that, you really had to connect with a healthcare provider to get that office flu test. Tamiflu, for the most part, is pretty well tolerated. Like Paxlovid, it's twice a day for 5 days. But Dr. Vanderhoff, I really want to let people know that Tamiflu also has another FDA-approved indication that a lot of people and providers have really forgotten about. Tamiflu can be taken once a day preventatively for people who have an at-risk condition who have had an exposure. So for example, if your grandma is 80 years old or someone is elderly in your family, if they've had an exposure to somebody with confirmed influenza, that's really a reason for that person to take Tamiflu once a day preventatively.
Thanks so much. One last question, just briefly. In terms of the flu vaccine, what are your thoughts about this year's flu vaccine? And is there still time for people to go ahead and get vaccinated?
Absolutely, Dr. Vanderhoff. The flu season typically starts, we really start seeing it in early December, but this year is a little bit different. And flu season typically goes sometimes until March or April. There's different types of flu, and yes, you can get flu more than once. There's influenza A, there's different strains of that, there's influenza B, there's different strains of that. But so far, the predominant circulating strain is a type of influenza A that's included in this year's flu shot. So that's very good news. And I think for me, it's really a no-brainer. I get my flu shot every year. It's something that I wholeheartedly recommend for everybody to get 6 months and older.
Thank you so much. Well, as I wrap up today, I want to mention that with the bitter, cold, and wintry weather that is in our forecast, it's important that we encourage our older loved ones and neighbors to be prepared. They should have an emergency kit and a plan in place if they encounter troubles such as losing power. It's also a good idea for all of us to check in with our elderly neighbors and relatives this weekend. Of course, getting together with loved ones and friends is one of the highlights of this holiday season. And even though we have these respiratory viruses circulating, what Dr. Gastaldo and I are telling you is that we can maintain these important traditions as long as we keep the basic precautions that we described in mind. So even though these respiratory viruses do pose challenges for us, we have the tools at hand. One of the very important tools, just to reemphasize, is the importance of staying home if you're not feeling well. One consideration that we've all gotten just much more adept at is consider joining your friends and family members virtually, rather than going in person and getting them sick for the holidays. And as we've mentioned, practicing good hand hygiene and considering the use of a mask can also provide significant protection in crowded settings. At the end of the day, it is about using good common sense to protect ourselves and our loved ones as best we can. So Ken, thank you. And I think we're ready to take questions.
Okay, thank you, Dr. Vanderhoff. Our first question today is from Jim Provence with the Toledo Blade.
Let me be the first to wish you happy holidays.
Thank you so much.
We've been talking a lot about the numbers currently in Ohio and nationally. I'm just curious as to what concerns you may have about the expectations for a surge in China coming up, and does that necessarily mean that the same thing will happen here?
Yeah, I think the situation in China is markedly different than what we're facing here in the United States for a whole host of reasons. Perhaps one of the most important reasons is that they do not enjoy the kind of very strong cellular immunity across their population that we have here in the United States. They have not had the same quality of vaccine that they've distributed across their population. And that vaccine-based immunity has not been augmented or challenged with the kind of hybrid immunity that we've developed here in the United States and in much of the Western world. And so sadly, I think they are facing a very difficult circumstance, but I think it's a very different circumstance than we have here in the United States. Dr. Gastaldo, infectious diseases is your specialty. What else would you add?
Yeah, Dr. Vanderhoff, I agree with everything you said. The other thing in China, too, is they have less vaccine uptake, specifically in the age group of 65 and older. And as everybody knows, that is the most vulnerable group to have really bad outcomes from COVID-19. So that is a concern in China, of course. But like Dr. Vanderhoff mentioned, another big factor is their zero COVID policy, and there's more people who are naive to the spike protein. There's many people there who are going to have their first date with the virus, and that potentially is going to lead to bad outcome in combination with a low vaccine uptake.
Okay, our next question comes from Spencer Hickey with Hannah News Service.
I'm having Zoom issues, so I put my question in the chat if you can hear me.
Yes, I can hear you. Just
the audio is cutting in and out all over the place, but so I'm not going to try to ask the whole question.
Ken, are you able to read me that question?
Yes, I believe so. Can you talk about the testing resources for RSV and flu, and will there be dashboards for data about them? It's probably best for me to ask by chat. Okay, I'm starting to read.
Okay, sure. So, first of all, in terms of RSV, it's a little bit different than when we're looking at COVID-19 because nearly all of that testing is occurring in the setting of hospitals and their outpatient or inpatient departments. There's a very, very good dashboard for RSV information that can, in fact, be broken down by state, and that's available on the CDC website. We have not really felt that there has been any need or compelling benefit to duplicating that already very, very good information, and it's displayed graphically quite nicely. As far as influenza is concerned, we, of course, at the Ohio Department of Health have a very good public-facing influenza dashboard that you can go to and find lots of information about influenza, including the status of the outbreak, hospitalizations, ER visits, et cetera. And of course, I think people are very familiar already with COVID-19.
Okay, our next question comes from Roosevelt Leftwich with Fox 8.
Yeah, Dr. Vanderhoff, if you could, can you address the fact of what area hospitals may be going through, not just across the state? Because I remember when RSV had its, first spike a couple of months ago, a lot of hospitals, especially those intensive care units for small children, they were having a lot of problems. Are you starting to see those types of numbers in hospitals, Columbus, Cleveland, Cincinnati? And are you fearful that we may see large amounts of hospitalizations coming January after the holidays?
Well, I think that's entirely possible. And it's part of the reason that we're working to get this message out about the importance of prevention, the importance of vaccination, and early treatment. The reality is that our hospitals are very, very busy. Not any one of these three viruses is showing a trajectory of, unrelenting increase, but they're present together in very, very high numbers. And it's placing our hospitals under, very significant strain. However, they are coping. They have become very adept at managing these high numbers, but we all need to do our part to help mitigate the risk of a severe outbreak after the holidays.
Dr. Vanderhoff, if I may add too, I think one thing to really consider with healthcare workers is that as healthcare workers, we are members of the community, and specifically here at Ohio Health and most medical centers, we don't want people coming to work if they are ill. So subsequently, with all these respiratory viruses going around, whether it be RSV, flu, or COVID or other viruses, there's the potential for us even to have more challenges in having enough healthcare workers to really be at the hospital taking care of patients. And that's something at Ohio Health that we keep a keen eye on, but we have very stringent messaging to our associates to really be mindful of that.
Thank you.
All right, our next question today is from Tom Jackson with the Sandusky Register.
Good morning.
Dr. Vanderhoff, I just looked at the latest numbers for the measles outbreak in Columbus, and I noticed that there have been 81 cases and 76 of those folks were unvaccinated.
Yeah.
I'm just wondering why you haven't focused more attention on that, and if you plan to announce any steps by the DeWine administration to try to encourage more parents to get their kids vaccinated against common childhood diseases.
Yeah, thanks for those very good questions. Well, so first of all, what we're seeing with the current measles outbreak is thankfully the kind of sinusoidal curve that we would normally expect to see with an outbreak. We hit our peak numbers a number of weeks ago, and now we're seeing things begin to trail off. Sorry, I'm just getting over a little bit of cold myself.
My gosh.
So as we're looking at those cases, all of the cases are either in individuals who are unvaccinated or incompletely vaccinated. And they all are stemming from this central Ohio outbreak. We have had one or two cases that are recorded in counties, one or two counties away from Franklin County, but those were as a result of exposures in the greater central Ohio area. And so as we're looking, there's been nothing unexpected about the outbreak. And it is one more reinforcement of what I have said many, many times, and that is our basic pediatric vaccinations are essential. They are extremely important, and why we've been very gratified by the robust response that has come from both the Franklin County and Columbus public health departments. And we've been grateful for the way that they have worked with us and with their communities in making additional vaccine clinics available and getting vaccines out to communities. The reality is that all of us need to remember that we don't live in a vacuum. We live in a global community. And while we may not be accustomed to hearing about many of these very bad pediatric illnesses that are vaccine preventable, those illnesses are still in the world. And if they're in the world, that means they can visit us unpredictably at any time. So this is not the time for parents to walk away from providing their children with the protection of very good, very safe, and tried and true pediatric vaccines like the measles, mumps, and rubella vaccine that these children, unfortunately, had not received or had not completed. Indeed, when you look at the number of cases, 81, 29 of those children required hospitalization. That's a pretty significant percentage of children who were sick enough to need to be in the hospital. And so we continue to work very hard to get messages out and to communicate the importance of childhood vaccination.
Okay, our last question today comes from Jesse Balmer with USA Today's Ohio Bureau.
Hi, thank you. My question is, what kind of information or data are you seeing about the difference in flu vaccination rates this year compared to past seasons? Obviously, there's more education about vaccines, but there's also a fatigue. So
Yes, very good. And actually, you can find some of this information displayed graphically on our influenza website, and the CDC also has similar information. But what we're seeing this year is a pretty solid uptake of the influenza vaccine. We're following essentially along with a pretty typical pre-pandemic year for vaccines here in the state of Ohio, which is good. It's encouraging. We would like to see more, but we've been gratified that despite some of the fatigue around thinking about these respiratory viruses, people nevertheless do appear to understand how serious they are and how beneficial vaccines can be.
Okay, thanks again for joining us today. Dr. Vanderhoff, do you have any closing remarks?
Well, I want to wish everyone a very safe and happy holiday season. And I want to encourage everyone to remember some of the prevention messages that Dr. Gastaldo and I shared today. And I want to particularly thank our colleagues in the press for your help in getting these messages out.
All right, this will conclude today's press conference. Happy holidays.
happy holidays.